All right, welcome to another deep dive, everyone. Today we're going to be taking a close look at understanding, well, palliative care. Before you click away thinking this is going to be some boring technical jargon fest, I promise you, this guide actually does an incredible job at explaining how palliative care works in practice.
Oh, absolutely.
So what we're going to do today is break down the most important parts of this guide, really dig into what makes palliative care unique.
Yeah.
How it's different from the kind of healthcare that's focused on curing someone, and all the things you need to think about when you're providing this kind of support.
It's a really important distinction to make, because when most of us think about healthcare, we immediately think about, getting better, right?
Right, exactly.
So, the treatments and therapies that are going to help you recover, and that's what our guide calls curative care. It's really about tackling that disease head on, trying to cure the illness, or helping someone recover from an injury.
Yeah.
And this can include, everything we usually associate with healthcare, seeing your doctor, nursing care, surgeries, medications, all kinds of therapies.
Yeah.
And this can happen in a hospital setting or even at home. But the main goal there is, to help you get well.
Okay, so with curative care, the focus is on getting better, on recovery. So how does that then shift when we're talking about palliative care? What makes it fundamentally different?
Well, with palliative care, the focus really shifts towards quality of life and comfort, especially when a cure isn't really a possibility or when someone's nearing the end of their life, just due to aging.
Yeah.
So it's really a different way of thinking about care, a philosophy that's specifically designed for those dealing with life-limiting illnesses.
Right, it's about making the most of the time that's left and focusing on well-being during that time. Now, I see our sources mention these national palliative care standards from Palliative Care Australia.
Yeah.
Can you tell us a bit more about what those are and how they play into this whole approach?
Yeah, so Palliative Care Australia has developed 9 of these standards, and they're basically a guide for making sure anyone receiving palliative care is getting really high-quality care.
Okay.
So, for example, Standard 1 focuses on respecting the individual, understanding their needs, and really considering their wishes when it comes to making decisions about their care plan.
Right.
And then we have Standard 6, which is all about meeting the specific needs of someone who's dying, emphasizing comfort and preserving their dignity.
Okay, so these standards are essentially like the cornerstones of compassionate care in these situations.
Exactly.
Can you give us an example of how these standards actually translate into real-life actions? Like, what would those look like in practice?
Yeah, absolutely. So for Standard 1, you might see families and the individual who's receiving care being actively involved in conversations and decisions about the care plan. It's all about making sure their preferences are truly guiding the direction of their care.
Makes sense.
And then with Standard 6, it could be something like ensuring a dying person has complete privacy for their final moments with their loved ones. Or maybe it's about really carefully managing their pain or discomfort to make sure they are comfortable and their dignity is preserved.
Right, so it's about making the person the center of everything and focusing on their experience, especially when they're at their most vulnerable.
Exactly.
Now, I find it interesting that our sources also link this whole conversation to a fundamental human right, Article 25.1 of the Declaration of Human Rights.
Yeah.
How does that fit into palliative care?
Well, it highlights that everyone has the right to a standard of living that supports their health and well-being.
Right.
And this directly applies to people receiving palliative care. It means they should have access to the necessary resources and support no matter where they receive that care. So whether it's through community services, a residential care facility, or a hospital, the commitment is there to make sure their quality of life is maintained, they're treated with dignity, their comfort is prioritized, and their essential needs are met.
Okay, so it's more than just medical treatment. It's really about ensuring their well-being as a whole.
Exactly. And that includes things like hygiene, nutrition, those basic needs we all have.
Makes sense.
And of course, along with that comes the medical care, the pain relief.
Right.
But it's all done while respecting their choices and communicating with them in a way that honors their dignity throughout the entire journey.
That's so important. And speaking of choices, I noticed our materials mention something called dignity of risk.
Yeah.
Which I have to admit sounds a little counterintuitive in a care setting. Can you explain what that means?
Yeah. So dignity of risk recognizes that even though someone might be facing a life-limiting illness, they still have the right to make their own decisions, even if those decisions might seem a little risky to others. It's about respecting their agency and their desire to live their life as fully as possible, even when facing these challenges.
So it's about allowing them to have those experiences, to live a life that feels meaningful to them, even if it involves some level of risk.
Exactly.
Can you give us some concrete examples of what dignity of risk might look like in palliative care?
Yeah, so our guide mentions things like choices around food and hydration.
Hmm.
So, maybe someone wants to eat a certain food or have a drink they love, even if it doesn't perfectly align with, say, the dietary recommendations for their condition.
Hmm.
It's about prioritizing their enjoyment and what brings them comfort. Oh.
Right.
Another example could be someone who wants to continue doing certain activities they enjoy, even if they involve a bit of risk, like a hobby or something.
Okay.
Obviously, reasonable adjustments and safety measures might need to be considered, but the idea is to let them engage in things that make their life feel fulfilling.
Right. It's a reminder that quality of life at the end of life isn't just about avoiding harm. It's about living in a way that feels right for that person.
Exactly.
Now, we can't talk about palliative care without talking about the role of family and loved ones.
Of course.
They're such a vital part of this whole experience. What do our sources say about their involvement?
Our sources really emphasize that family, loved ones, and caregivers are not just visitors. They're crucial members of the care team. Their insights and perspective are incredibly valuable, and it's so important to make them feel included and respected throughout the whole process.
What are some practical ways to involve them and really show that their input is valued?
Well, one way is to actively involve them in care tasks, if they're willing and able to help.
Right.
This recognizes their relationship with the person receiving care and allows them to feel helpful and connected.
Yeah.
Another important thing is to regularly ask for their advice on providing care.
Mm-hmm.
They often have such a deep understanding of the person's history, their likes and dislikes, their needs.
Yeah, they have all that personal knowledge that a healthcare professional might not have right away.
Exactly. So they're really invaluable resources.
Okay, now we've mentioned this idea of a holistic view a few times. What exactly does a holistic approach mean in the context of palliative care? What does it actually encompass?
So the holistic approach means looking at the whole person, not just their physical symptoms.
Mm-hmm.
It's about understanding and addressing their emotional well-being, their social needs, their economic situation, even their spiritual needs.
Wow, so it's really a much broader lens than just focusing on the medical side of things.
Exactly. It's recognizing that all these different parts of a person's life are interconnected.
Right.
And to provide truly effective care, we need to consider all of them.
It makes you realize how complex and personal this whole experience is.
Absolutely.
Now, how do caregivers build that trust and connection with the person receiving care and their support network? It seems like trust is such a huge part of this.
Yeah, trust is paramount. And that's where building rapport comes in.
Mm-hmm.
When people feel comfortable and safe, they're more likely to be open and honest about their needs, their preferences, their worries. It creates a space where those sometimes difficult conversations can happen more easily.
So what are some of the benefits of establishing that strong rapport?
Well, it makes people feel heard and valued. And it gives them the confidence to talk about really personal and sensitive things related to their care and their wishes for the end of their life.
Okay, so it's about making them feel seen and understood, which is so crucial in these situations.
Absolutely.
Now, how do caregivers know if they're truly meeting someone's goals for quality of life and comfort?
Yeah.
Especially when the person might not always be able to express themselves clearly. How do you gauge that?
It takes a few different approaches. First, you always refer back to their care plan that outlines their goals and preferences. Then it's about careful observation, picking up on those nonverbal cues about their well-being.
Right, with their body language and facial expressions.
Exactly. And then, when possible, you ask open-ended questions directly to the person and to their family and caregivers, too.
Right, because they have that deeper understanding of the person.
Absolutely. They can provide really valuable insights.
So you're gathering information from all these different angles to get a complete picture.
Exactly.
Earlier, we talked about the expertise of family and friends. And I see our guide specifically calls them non-organizational carers. Why does it highlight them as being such important experts?
Well, because of their shared history with the person, they have this deep understanding of their customs, their beliefs, their values, their preferences, and they often know these things much longer than the formal care team does.
Right, they hold a piece of the person's life story that's really unique and irreplaceable.
Exactly.
Now, another thing our sources emphasize is the need to create a supportive environment. What does that actually look like for someone facing a terminal illness? What are the key elements of that environment?
It's about creating a space where they feel safe, respected, and genuinely cared for. When that's in place, they're much more likely to open up and communicate honestly about their emotional needs and their preferences.
Okay.
So it's about fostering that open and honest communication during a very difficult time.
So it's about making them feel comfortable enough to express themselves without fear of judgment or dismissal.
Exactly.
Our materials have this interesting table showing how someone's priorities and preferences can actually change when they're facing a life-limiting illness.
Right.
It touches on those holistic needs we discussed earlier. Can you
Mhm.
walk us through some examples?
Yeah, sure. So let's take lifestyle, for example.
Mm.
Earlier in life, someone might have been very particular about their routines, like their sleep schedule or their diet, or maybe they had certain indulgences they enjoyed.
Yeah.
But towards the end of life, those things might not matter as much anymore.
Right.
They might choose comfort over strict routines,
Mm.
or maybe they decide to enjoy those things they used to deny themselves.
Yeah, it becomes less about long-term goals and
Mhm.
more about what brings them joy and peace in the moment.
Exactly.
What about social needs and how those might shift?
Well, someone who was always very independent and enjoyed their own company might find themselves wanting more connection and quality time with loved ones as they get closer to the end of life.
Okay.
And on the flip side, someone who was always the life of the party might find comfort in quiet, solitary moments.
Right.
Their preferences around touch and communication might also change significantly.
It's fascinating how these fundamental needs can evolve in such profound ways.
It really is.
Now, with all these potential shifts happening, what kind of mindset is important for caregivers to adopt? I see our materials emphasize a non-judgmental approach. Why is that so important?
Because as caregivers, our role is to support the person's choices, not to judge them based on our own values or beliefs.
Right.
A non-judgmental approach builds trust and lets the person feel like their culture, their values, their ideas are all respected.
Mm-hmm.
And that empowers them to make their own decisions about their care and how they want to live their remaining time.
So it's about honoring their autonomy, even if their choices might be different from what we would personally choose.
Exactly.
Now, on the other side of that, it's also important to know where the boundaries of a caregiver's role lie in palliative care. What are some things that would typically fall outside of someone's scope of practice?
So generally, things like administering certain medications like strong painkillers would be outside their scope.
Okay.
Unless, of course, they have specific training and qualifications.
All right.
The same goes for things like massage therapy or aromatherapy. And they shouldn't be making any changes to the care plan without proper authorization.
Makes sense.
And then providing formal counseling or therapy is definitely outside the scope of a caregiver's role.
So what should a caregiver do if they're asked to do something that's beyond their role?
Well, first and foremost, they need to communicate clearly and respectfully that the task is outside their scope of practice.
Okay.
And then they need to refer the request to their supervisor or another qualified member of the healthcare team.
Right. So clear communication and knowing when to seek additional support are key.
Exactly.
Now, providing emotional support is obviously a huge part of palliative care. What are some good examples of supportive communication techniques?
Well, being courteous and empathetic is fundamental,
Right.
and respecting cultural differences and providing non-judgmental support are really important for building trust.
Yeah.
Active listening is crucial too, really focusing on what the person is saying and trying to understand their perspective. And then things like respecting individual differences, using appropriate touch, and making eye contact can all contribute to that feeling of support.
Okay, so it's really about creating a safe space where they feel heard and understood.
Absolutely.
And on the other side of that, what are some examples of communication that would be inappropriate in these sensitive situations?
Things like being rude or disrespectful, lacking empathy, dismissing their cultural differences, or judging their choices and feelings are definitely not helpful.
Right. Those are all pretty basic things to avoid.
Yeah. And ignoring their concerns, using inappropriate touch, or staring at them for too long would also be considered inappropriate.
Okay, so it's about being mindful and respectful, even more so given the vulnerability of the person.
Exactly.
Now, I want to talk about something called an Advance Health Directive, which our materials mentioned.
Yeah.
Can you explain what that is and why someone might choose to create one?
So an Advance Health Directive, sometimes called a living will, is basically a legal document where someone outlines their preferences for future medical treatment.
Okay.
It's usually done in case they become unable to communicate those wishes themselves.
So if they're in an accident or become very ill and can't speak for themselves, this document speaks for them.
Exactly.
That's a really good idea.
Yeah, and people often create these directives to make sure their voice is heard even when they can't speak for themselves, and that their preferences, their personal, cultural, and spiritual beliefs are respected.
Right. So it's about maintaining that control over their healthcare, even in difficult situations. What are the steps involved in making an advance health directive a legal document?
Well, the person creating it needs to understand what it means and what it covers.
Mm-hmm.
Then they fill out the form, clearly stating their preferences.
Okay.
And sometimes they might appoint someone like a health attorney to make decisions on their behalf if they're not able to.
Right.
It's really important that they're doing this willingly and that they fully understand what they're choosing.
Makes sense.
Often a doctor will need to confirm that they have the mental capacity to make these decisions.
Okay.
And then the document needs to be signed and witnessed by someone authorized, like a justice of the peace or a lawyer.
So it's a pretty formal process to make sure it's legally sound and that their wishes are clearly documented.
Exactly.
What are some specific requests or preferences someone might put in an advance health directive that a healthcare organization would be legally obligated to follow?
They can specify things like whether they want to be resuscitated if their heart stops.
Okay.
They might also appoint that health attorney we talked about.
Mm-hmm.
And they can outline their preferences for specific treatments, like being on a ventilator, receiving artificial nutrition and hydration, taking antibiotics, and even things like organ donation.
Wow, those are some really big decisions.
They are, and it's important that people have the opportunity to make those choices for themselves.
Now, for caregivers who are providing daily support, how do they know what specific care is needed for each person? What do they refer to?
They usually refer to a document called a care plan.
Okay.
Sometimes it's called an individual plan or a support plan.
Right.
But basically, it outlines the person's specific needs, their preferences, any instructions that the caregivers need to follow.
So it's like their personalized guide for providing care.
Exactly.
Okay, let's move on to a case study that's presented in our materials.
Mm-hmm.
We have Donald, who has terminal cancer, and he says he wants to stop taking his medication to speed things up.
Mm-hmm. That's a tough one.
It is. So how should a caregiver respond to the emotional side of Donald's disclosure?
Well, the most important thing is to respond with empathy and respect. Really listen to what he's saying, acknowledge his feelings, and show that you care about how he's doing. But avoid giving your own opinions or judging his decision about the medication.
Okay, so it's about showing that you've heard him and that you're there for him without pushing your own views.
Exactly.
Now, how should the caregiver respond to Donald's actual intent to stop taking his medication?
They should try to understand his reasoning, maybe ask some gentle questions about why he feels this way and what he's considered.
Okay.
But then it's important to explain that while they respect his feelings, the decision to stop medication needs to involve his doctor and the healthcare team.
Mm-hmm.
They need to make sure he has all the information and that his wishes are documented and addressed properly.
Right, so it's about finding that balance between supporting his autonomy and making sure he's making informed decisions within the framework of his care plan.
Absolutely.
So what are the immediate things the caregiver needs to do after this conversation with Donald?
They need to document everything carefully. Donald's wish to stop his medication, the details of the conversation, their observations of his emotional state, and then they need to report all of that to their supervisor or the appropriate healthcare professional.
Okay, so thorough documentation and communication are essential.
Exactly.
Let's shift gears a bit and imagine a situation where a client starts moaning and seems distressed during repositioning.
Okay.
What should the caregiver do right away?
They should stop repositioning immediately.
Okay, good.
You don't want to do anything that could cause more pain or discomfort.
Right.
Then make sure the person is safe and comfortable in the bed. Ask if they're in pain, and if they are, try to understand where the pain is, how bad it is, and what kind of pain it is.
Okay.
Then report all of that to the nurse or doctor in charge. And in the meantime, they can suggest some non-medication pain relief strategies that are already in the person's care plan.
Right, like those comfort measures we talked about.
Exactly.
And of course, follow any instructions from their supervisor.
Absolutely. And document the whole incident thoroughly.
So safety first, assessment, communication, and sticking to the care plan are the key takeaways there.
Yeah, that pretty much sums it up.
Speaking of pain management, What are some examples of things besides medication that might be in a palliative care plan to help manage pain and discomfort?
Oh, there are lots of options.
Okay.
Things like changing their position frequently to prevent pressure sores and stiffness,
Mm-hmm.
using special mattresses and cushions that relieve pressure,
Right.
maybe gentle massage if it's appropriate,
Right.
some light exercise if they're able to,
Mhm.
aromatherapy with calming scents.
Interesting.
Even things like acupuncture, meditation, and distraction techniques can be helpful.
Wow, it's a really broad approach.
Yeah, and of course, if medication is needed, that's managed by the doctors and nurses.
Right, it's about combining those medical interventions with these other approaches to create a comprehensive plan.
Exactly.
How do caregivers know if these pain management strategies are actually working? How do they measure effectiveness?
It's a combination of observation and communication.
Okay.
So they're looking for signs that the person is more comfortable, like changes in their facial expressions, their body language, whether they're moaning less.
Mm-hmm.
And if the person can communicate, they can ask them directly about their pain level and if they're feeling any relief.
Right.
All of that information should be documented, along with what strategies were used.
So it's about monitoring, gathering feedback, and adjusting the approach as needed.
Exact.
Now, I want to talk about some common misconceptions surrounding pain relief medication in palliative care that our materials highlight.
Right.
The first one is this idea that you shouldn't give pain relief until you know exactly what's causing the pain.
Right, which isn't really the best approach.
And why is that?
Well, waiting for a diagnosis can take time,
Mm,
and in that time, the person's pain might get much worse.
right.
And in palliative care, where the focus is on comfort, it's just not considered ethical to leave someone in pain, especially when sometimes the cause of pain can be really hard to figure out.
Yeah, the priority should be on alleviating their suffering.
Exactly.
Okay, what's the second misconception?
It's the idea that pain medication should only be given when the person is actively experiencing pain.
Oh.
But that's not ideal because pain meds often take some time to work.
Right.
So if you wait until the pain comes back full force before giving more medication, the person ends up going through these cycles of pain and relief, which is really unnecessary.
So it's better to stay ahead of the pain and prevent it from becoming severe.
Exactly.
What are some of the negative things that can happen if these misconceptions about pain management aren't addressed?
Well, the person might experience these waves of intense pain followed by relief,
Mm-hmm.
and that can make it hard for them to do even simple things, which leads to a loss of independence.
Right.
They might also lose interest in eating and drinking, and they might become really distressed, even angry.
Yeah, it can really impact their overall well-being.
It definitely can.
What should a person do if they feel like these misconceptions are affecting their care?
They should definitely talk to their supervisor or the nursing staff.
Okay, good to know.
It's important that they advocate for themselves and make sure their pain is being managed effectively.
Absolutely.
Right.
Now, our materials mention the aged care quality standards. How do those relate specifically to palliative care?
Well, they're not specifically focused on palliative care, but they do have a lot of relevance.
Okay.
Several of the standards actually support the core principles of palliative care.
Hmm.
Things like person-centered care, respecting individual choices, ensuring a good quality of life.
Right, so they create a framework for providing quality care, and that includes palliative care.
Exactly.
Now, we've talked about how someone's needs and preferences can change quickly in palliative care.
Yes.
How important is it for caregivers to regularly check the care plan given those changes?
It's extremely important
Right.
because the care plan might have been updated recently with new instructions about medications, comfort measures, or end-of-life wishes. So the caregiver needs to stay up to date to make sure they're providing the right care.
It's a living document that needs to be constantly reviewed and updated.
Exactly.
Now, let's talk about places where someone might choose to die. Our materials mention a few different options.
Mm-hmm.
Can you outline those and maybe highlight a key benefit of each?
Sure. So one option is to die at home.
Okay.
The big benefit there is that it's familiar and comfortable.
Right.
They're surrounded by their own things and memories.
Mm-hmm.
Another option is a palliative care service or hospice.
Okay.
And there, they have a team of specialists who are experts in end-of-life care.
Right, so they're getting that specialized support.
Exactly.
What about a hospital?
Hospitals offer round-the-clock care, constant monitoring, and a quick response if there are any complications.
Right, so it's about having that readily available medical expertise.
Yeah.
Are there any other options?
Some people might choose to stay in a residential aged care facility.
Okay.
It's often more home-like than a hospital, but they still have 247 nursing care.
Right, so it combines those elements of familiarity and support.
Exactly.
Is there a document where someone can officially state their preference for where they want to die?
Yeah, they can include that in their Advance Health Directive.
Okay, and why is it so important to respect that documented request, if at all possible?
Well, for a few reasons.
Mhm.
Firstly, the Advance Health Directive is a legal document, so it should be followed.
Right.
Secondly, choosing where to die is a fundamental part of someone's autonomy and their right to make decisions about their own care.
Yeah.
And thirdly, the choice might be tied to their cultural or religious beliefs.
Mhm.
So not respecting their wishes could be very disrespectful and distressing for them and their family.
It really highlights the importance of honoring their wishes, especially at such a sensitive time.
Absolutely.
Our materials also mention a resource from the Migrant Information Center in Melbourne.
Yes.
It talks about palliative care for culturally and linguistically diverse communities.
Right.
Why is cultural sensitivity so important in palliative care?
Mm-hmm. It's crucial because different cultures have different beliefs and practices around death and dying. And it's important to understand and respect those differences to provide truly culturally sensitive care.
Yeah, it's about making sure the care is tailored to their individual needs and beliefs.
Exactly. The resource specifically highlights things to consider for different language groups,
Okay.
like Cambodian, Chinese, Indian, Iranian, Sri Lankan, Vietnamese communities.
Right.
But even within those groups, not everyone follows all the traditions. So the most important thing is to talk to the person and their family directly.
Right, to really understand their individual needs and preferences.
Absolutely.
Okay, lastly, I want to touch on the Voluntary Assisted Dying Act 2021 in Queensland.
Yeah.
Can you briefly tell us why someone might choose to access that program?
Well, there are many reasons.
Okay.
Some people might have incurable conditions that are causing a lot of suffering, and treatments aren't working anymore. They might be facing increasing deterioration, dependence on others, unbearable pain, and their quality of life might be severely diminished.
It's about having that control over how and when they die.
Exactly.
What are some of the things a doctor looks at when assessing someone's eligibility for VAD?
So they need to make sure the person has an eligible condition that's incurable and will lead to death.
Okay.
They also need to be sure the person can make their own decisions and that they're not being pressured or coerced in any way. They need to be at least 18 years old, and they need to meet residency requirements.
So it's a very thorough assessment to make sure they meet all the criteria.
Absolutely.
Once someone started the VAD process, can they change their mind?
Yes, they can change their mind at any point.
Okay, and why might someone choose to do that?
There are many reasons.
Okay.
Maybe they get scared or have second thoughts. Maybe other treatments start working better, or they want more time with their loved ones.
Right.
Or maybe their religious or cultural beliefs influence their decision.
So it's not a one-way street. They have that flexibility to change their mind. Let's say a caregiver, Daryl, is supporting someone going through the VAD process, but Daryl has personal beliefs against VAD. How could that conflict affect their ability to provide good care?
Well, if Daryl isn't careful, their beliefs could make it hard for them to be impartial and truly respect the person's choice.
Right.
The person might sense Daryl's disapproval, even if it's not said out loud. And that could make them feel pressured or shamed, which could damage their relationship and make it harder for them to be open about their needs.
So it's really important for caregivers to separate their personal beliefs from their professional duties.
Absolutely.
They need to prioritize the person's autonomy and well-being above all else.
Exactly.
Well, this has been a really insightful deep dive into palliative care. We covered so much, from the basics of palliative care to the nuances of pain management, ethical considerations, the role of family, and even those sensitive end-of-life choices.
It's a complex topic, but hopefully we've shed some light on the key principles and practices.
I think the biggest takeaway for me is that palliative care is about so much more than just medical treatment.
Absolutely.
It's about dignity, respect, and ensuring that people have the best possible quality of life, no matter what they're facing.
It's about honoring their wishes and making them feel supported and cared for.
Exactly. So as we wrap up, we hope you'll take some time to reflect on what we discussed today.